Now, watching a relative struck down by serious illness or injury is often cited as one of life's most stressful experiences.
But for families who can't agree with doctors about the best treatment, that strain is compounded by the need to take costly and often upsetting legal action.
Now, a leading anaesthetist, Dr. Danbury, is calling for mediation to be made mandatory in such cases before they can proceed to court. He joins us from our London studio. Dr. Danbury, good to see you. Just explain then, since you are a medical mediator, how this happens, how it unfolds.
Okay. Well, I got involved in mediation because of experiences in the Court of Protection with the types of cases you talk about, and it's very distressing for the families and also the teams concerned. Although the judgments by in the court are often very, very good indeed, the medical professionals and the families are left the next day with the patient, and the courts go on to consider something else. And it's a question of the doctors and families trying to pick up the pieces when the relationship has been destroyed by the court case. Mediation provides the opportunity, it's not compulsory at the moment, it provides the opportunity to keep that relationship, to come to a compromise and to get some sort of agreement between family and treating teams as to what is the best thing to do for the patient. And
you're saying that this process, when obviously they have to tell a family that their loved one is dying, that is the most stressful moment for the medical team, for the doctor?
Absolutely. The hardest thing I do is talk to families of critically ill patients, and very occasionally a relationship between the clinical team and the families break down. Okay. And we have to have a way of resolving that. Okay,
we understand that, but I think most people watching will feel that a family has the right to know and to find out more when they're in this terribly distressing situation, and maybe there isn't the trust in the doctors. So shouldn't they have that opportunity to go to court and find out as much as they can?
Oh, absolutely, absolutely. The courts are always there. I'm just advocating another stage before going to court. Emotionally, it's far easier to sit down around a table and discuss the issues rather than confront the medical team, if you're a family, in the court. As I say, the day after the court case, the lawyers have moved on. And the families and the doctors have still got to talk to each other over the patient. So this is a way of preserving relationships and coming to the right decision. It doesn't replace the court, but it's an additional layer, if you like.
I'm just speaking from a little bit of experience here in our family, and I can remember the moment we were told that a relative was dying, and you don't want to believe it, and also you are suspicious because there's so much pressure on the NHS at the moment. Our relative had cancer, and you think, well, are they just washing their hands of him because he's got cancer? And that's the problem, isn't it? There isn't the trust there sometimes.
Yes, occasionally there isn't the trust, and that's exactly the sort of situation when you need somebody to broker and to help the conversation go on. I mean, if the mediation process doesn't succeed, then the courts are always there. The courts are always the final place to go. But the outcomes of the cases that I've been involved with have been far better when mediation's been involved than going straight to the court.
What about the instance where religion or culture might play a part in this? Because obviously turning off a machine, some people for religious beliefs might not believe that's the right course of action.
Absolutely, and the mediators don't necessarily need to come from a medical or a legal background. There are some extremely good religious mediators from all of the different faith groups. So it's about allowing a conversation which perhaps has broken down between clinical team and family, but allowing that conversation to continue and trying to take the pressure out of it. Court is an incredibly pressured environment, and it's much better to talk than litigate, in my view.
OK, Dr. Chris Danbury, thank you very much for joining us this morning. You might have some thoughts about that. You might have your own experience of it. It's a sensitive area. If you do send your thoughts in, and we'll discuss some of them later.
You get in touch, usual addresses, and on Facebook and on Twitter, of course. 7:15 is the time. You're watching Breakfast from BBC News. Here are the main stories.